everyone. We are so happy to have you, whether you are joining us here today or will be watching later on our Cure GABA-A YouTube channel. We ask that you please mute your mics if you have not done so already, and include any questions that you might have in the chat box below. I also wanted to mention that our Cure GABA-A patient care representative, Agustina Fernandez, will be on the call today and available after. Please schedule a meeting with her if you need any assistance onboarding to this or any other platform, or if you have any other questions. She's also available for direct messaging during this webinar. My name is Monica Joanna Almacabe, and I'm the founder and CEO of Cure GABA-A, a nonprofit organization with the sole focus to develop potential therapies for GABA-A variants by partnering with world-renowned researchers in GABA-A and the Organization of Patients for Clinical Trial. And today we welcome Andrea Rogers from Across Healthcare. Andrea Rogers is an experienced IT program and project manager with over 25 years of experience in healthcare IT project management, currently serving as VP of Project Management at Across Healthcare. She collaborates closely with rare disease advocacy groups to implement data collection platforms. Her complete bio is on our website. I'm handing it off to you, Andrea. Please share with us the importance of data collection through the Matrix platform, its capabilities, and how we can onboard.
Thank you so much. I'm so happy to be here with you today. So the intent today is to show you the Matrix platform, how to join and how to enter your data in that platform. But just a little bit of history about Across Healthcare. The CEO and founder of Across Healthcare, Jason Colquitt, started this company over 10 years ago, and he left briefly for a time to work for IQVIA, which is a large clinical trials company, and that's where I actually worked with him running a number of large global registries for one of their clients. And one of the things that really especially broke Jason's heart was the fact that he sold multi-million-dollar data collection platforms to these very, very large organizations, but could not scale it for the smaller advocacy groups, the populations of, under 50, under 100, to where they could afford to be able to capture the data that they need to be able to capture. So he left IQVIA and had a vision for developing the Matrix platform. He spent the whole first year talking to families and patients about, if we could build a tool for you, what would it entail? And they really took the approach of going from patient data collection. He refers to it as left to right. So starting with the patient, then involving the clinicians and the researchers, instead of starting from a research perspective. So I joined him about 3 years ago at Across Healthcare. My team works with all of our groups on onboarding and then collaboration once they implement the Matrix platform. But really our whole desire is to be able to provide this platform for any rare advocacy group to collect data, especially longitudinal data studies, to be able to provide to researchers to try and help find cures for these rare diseases. So I hope that helps with a little bit of background about our role. So I will go ahead and share. And as I'm sharing, please feel free to interrupt with questions, Monica. If there's something else you would like me to cover, I'm happy to move around within the platform and elaborate on anything that you think would be of value to your community. So, all right, so I'm starting out. This is obviously your website, and scrolling down to number 5 is register for Matrix with a join button here. And so to join the platform, you would just click on this button. And I've already kind of gone through some of the steps to help the process here, but you will see a request access form with the Combined Brain logo at the top. All you've got to do is put in your first and last name and your email address to request an account in the platform. I want to point out a couple of things on this form. You will have to check, that you're 18 years of age or older, and you acknowledge that you're either in the United States or your data will be shared in the United States. But really importantly, if you're a parent who is going to be entering data for your child, when you're looking at the type of account that you want to set up, you want to be a caregiver participant. So this is the account type that you're setting up. You would not choose patient participant unless you are actually the one with the rare disease. So it's really important to select caregiver participant. You'll be able to set up your account, and then you'll be able to add your child. So once you select that, you will just click sign up, and you will receive an email with a link in it to set your password up for the platform. Once you get your password set up, you will have a login page or be directed to the login page for Combined Brain. And this is my user that I set up earlier. So I'm going to go ahead and click sign in. Note that if you forgot your password, you can always click the link on that page to get help resetting your password. So again, as a parent, when I first come in to set up my account, there will be a terms of use statement for the platform. So you can read through that and accept it. And then the system will ask you to go ahead and fill in your demographic information. So I'm just going to type in some basic information here with the city, a state, zip code. And again, this is my date of birth as the parent. So I'm not going to enter my actual date of birth, but definitely want to be over 18 here. My phone number. And then there's some additional information here at the bottom about relationship and race and ethnicity. You can complete this, or any of these options have a prefer not to answer, or an other if you feel that the categories don't adequately reflect you. So I can choose prefer not to answer. We'll go through and complete these last couple things. There is some information requested on birthplace. And again, this is just for record matching. I'm just going to type test in here since this is a play account. And then estimated household income, which again, I have a prefer not to answer if I choose. I have not associated any patients to my account yet, so there won't be anything listed here. I will go ahead and save my demographic information and then click finish to finish what we call that startup workflow. So now I'm actually in the Matrix platform. You can see this is, again, under the Combined Brain instance, so you'll see their logo at the top. But the first thing I want to do now is add my child, which is my example for today. So I'm going to add a child named Mary and indicate if she's deceased or not. And the answer here would be no, that only I will be accessing the account because she's a minor. So just the name, those two questions, and save. And what this will do then is it will take you into a startup workflow for your child. So you can see down the left the things that you'll need to complete, which is the informed consent. Again, updating that general information screen for your child. The health and development survey, which is a general head to toe survey that was provided by ClinGen, and then a request to upload genetic tests. So the first thing it's going to ask me to do is ask me my relationship to the person that I just added. So I'm going to go ahead and select that I'm her mother, and yes, she is biologically related to me. So you'll see that step is now checked down the left, and it will now take me down into my child's record. So the first thing you need to do is complete the informed consent for your child. I'm going to go ahead and scroll down here. I think there are a couple of questions on the Combined Brain consent, but you'll want to read through this. You'll indicate the option, whether you're an adult participant. In this case, I'm a parent or guardian. You would complete the questions. I give my consent to completing in this study. There's a question about willingness to complete online interviews. So you can read through all of this. I'm going to go ahead and just check yes on everything. The name of my child is Mary, and the name of the parent is Danny. And it will automatically date it for you, and then you can complete the consent. If you would like a copy of it, you can check this box and you'll get an emailed copy of it. Or at any time on the platform, you'll be able to email yourself a copy or view it or retake your consent, and I'll show you that here in a minute. But I'm going to click consent. I do need to go through and update the general information for my child, which in this case is the same as me. So I will type that information in quickly. My child's date of birth. So we will say she's a young one. And then I'll go through and fill out the demographic information on her. So it's pretty quick. Birth information, estimated household income. I'll just check something there. You can indicate if the patient has health coverage or not. This is intended to be worldwide. If you click yes, it will ask you the type of health coverage that you have. You can indicate that. And then most importantly on this page is indicating the organization that you're affiliated with, because this will allow Monica and team to pull data just for your organization. So it's really important. You want to select this Cure GABA-A variants for your child. There is an option underneath for a control, and this is intended, say you are providing biosamples, and not only are they collecting from your child, but also for you, and you set up account, you would in that case be a control. But for the child, we definitely want to select just the Cure GABA-A variants. And then you will save their general information. And now it will take you into a health and development survey. This is a really quick head-to-toe survey that just asks about the different body systems and whether you have or your child has issues with any of these. Based on these responses, you will get a more in-depth survey about that particular area. So if you check that you had issues with brain and nervous system, then you will get a follow-up survey about brain and nervous system. We do it this way to really try and minimize survey fatigue. I'm a parent of a child with a rare disease, and I know sometimes it feels like I fill out the same surveys over and over and over, asking the same information. So we really try to focus on narrowing the information that we're asking you for. So I can select if I've had genetic testing or not, the types and the reasons. Do you have a copy of your results? Yes or no? And we'll ask you to upload those in a bit if you have them. Have you been told there were issues with the mother's pregnancy? So just real quick, you can go through and indicate whether you've had issues with any of these particular areas. So I'm just going to complete this really quickly. And this is actually a survey that the development was funded by the NIH, and the survey was developed by Genome Connect. And they're wonderful about sharing it out with anybody who doesn't have their own data collection surveys to allow them to start collecting data using these very broad surveys. So I went ahead and checked a number of those. And once I complete that, there will be a check mark on the left. And the last step is it asks me if I have a genetic test to please upload it. So it's really simple. You just click the button and you would click upload to select the file, and it will label that as a genetic test. So it's really important to upload these reports if you have them. Combined Brain has genetic counselors that then review them and pull the data out into a structured format. And this allows us to take that genetic information plus the phenotypical information we get from your surveys, and that gives a really broad set of data to be able to provide to potential researchers. So I'm going to go ahead and cancel this. If you don't have it immediately, it's okay. You can always add it later. You can just check I don't have it at this time. But if you do have it, it's really good to go ahead and upload it so you don't forget. And that's my last step. So you'll see the finish button here at the bottom, and I can click finish. Then it's going to ask me if I want to go back to my dashboard, where I could add another participant if I have one, but I don't. So I'm just going to go ahead and say I would like to go into my daughter Mary's record. So now I'm in Matrix. I have finished that mandatory startup workflow. Didn't take me too long, but now I'm in the entire Matrix platform that's open. So I'm going to talk about a couple of these options down the left. Of note, it's always going to remind you who you are up here in the upper left. So I logged in as Danny, and I'm viewing Mary's record. This is just a dashboard that's telling me some of the new surveys that have been added for me to complete. But I'm going to go ahead and walk down this left side really quickly. If you do have any updates to that general information page that you initially filled out, you can edit it by clicking on the screen and clicking the edit button. but the main bulk of your time will probably be spent completing surveys. And you'll be able to see any new or in progress surveys here on this tab, and then any completed surveys over on the completed tab. And if you have any updates or want to change something, you can always click on this 3-dot menu over here and retake the survey, and it will take you back into the survey with your prior responses and let you update them. But note that you've got a couple of things I want to point out here. So everything under level 2, this is a direct result of what I answered yes to on that head to toe survey. So I answered yes to behavior problems and blood and bleeding. So then I will be able to complete the more detailed information in these particular body systems. If you don't have all of these, then you won't be assigned this survey. But they're all formatted this way. You'll have a number of more specific syndromes or symptoms that you can respond to. You would just answer whether you see it or not, and then it will give you a column to enter the age symptoms first appeared, and then the age at diagnosis for those items. So you would just complete this. If there's something else that's not on the list, you can add it here and then save the survey. And typically on these surveys, we ask you to complete them once a year. So we will reassign it to you. It will show up on your new survey list. We'll pull forward all of the responses that you answered last time. So all you really need to do is review and make sure nothing has changed, and then resave it. And that gives us those longitudinal data points to watch as the disease or syndrome progresses. There is a study participation questionnaire, which is important up here at the top. This is where you indicate if you are participating or plan to participate in the biorepository. And if you say yes, then you will be presented with a biorepository consent. This allows you to do that consent online, and then there's some additional surveys affiliated with that. So that's just a real quick one question one, and you see my consent popped up right after I completed it. There are also some surveys like a CDC milestone checklist, which is a standard survey. We'll calculate your age and then ask you a number of status on a number of items and what you should be able to do by your particular age. So it's real simple to go through and edit that. Once you hit, I think it's age 10, when this kind of tops out, then it'll just ask you when you come in if you've had any progression or regression, and if you say no, then you don't have to fill anything else out again. So I'm going to go ahead and close that. On any of these surveys, it's important to note that it saves your survey every time you click next page. So even if you got kicked out because your internet dropped or you decided you just don't want to finish it right now, you can close out of it and it will save your progress, and then you can resume at that point going forward. So that's quite a bit about the surveys. And then again, just wanted to reiterate, if you have changes, all you have to do is click this 3-dot menu and you'll be able to retake that survey or email a copy to yourself off of those menus. Next, I'm going to talk about health information. This allows you to enter information on medications, conditions, treatments, etc. But the other thing that you can do is click on this top item, and there is a connection or the ability to connect to any of your EHR portals. So like my daughter has 3 or 4 different MyChart accounts at different providers. So if you click the import health records, it actually takes you to our partner site, which is called Greenlight. And it actually allows you to go in, search for the facility, put in your credentials, and then every 7 days, we go pull new information from those portals. And it will populate into these areas. So it'll pull in any treatments, medications, procedures, etc. And then you can supplement it by just adding in, if something is missing, you can add in your own items here. Again, this is just another piece to that data collection. Having the surveys, having the curated data, and also having the medical records information is really important. You can click on here and just start. Just type and it will search a database and allow you to select, in this case, a particular condition, and then just save the items out there. So that's our EHR integration piece. Symptoms and activities I know is very broadly used at Combined Brain, and this allows you to capture more daily information as opposed to like surveys that are once every 6 months or a year. And typically people will track things like seizures or any other particular symptoms that you want to track. So I'm just going to add that as a symptom that I want to track here. And then anytime it happens, all I have to do is click the plus sign. It will date and time stamp the event. I can put in notes and rate the severity of it. And then just indicate if it's an improvement, a worsening, or a stabilization, and save it. And what it will do is it will increment the numbers here. So if I click it again for today and just save it, you'll see that changes to it too. And so you can track symptoms this way. You know, even something, I'll just put in one more here, so like poor appetite. And then again, I can click it to add it. I'm going to go back a day, say it happened yesterday at this time, and add that in there. So you can see just the incrementing. And it's important because we're going to be able to graph this here in a minute, which is really helpful. And then I was telling Monica earlier, one of the great examples of this was one of our parents noticed that anytime there was like an increase in barometric pressure, her daughter had more seizures. So she's tracking an increase in barometric pressure. And she added that as one of the activities she wanted to track against. But this could be physical therapy, it could be immunizations, just anything that you think may have some kind of bearing on the symptoms that you're seeing. And it works the same way. Just simply click on it, it'll date and time stamp it. You can revise if you want, and then save it. So once you start tracking this information, as well as putting medications in, you have access to this insights section. And what it allows you to do is click on items that you want to plot against each other. So I only have 3, so I'll pick all 3, but you can pick up to 6 items and then apply it. And it will start to plot these. And of course, mine's kind of boring because I only have a day or 2 in here. But what you really hope to be able to see is that when certain things happen, then I see an increase in these particular symptoms. So this is really important for the kind of that daily, a little bit more anecdotal evidence to pair with that survey data that we're collecting. And then in addition to that, there's a number of other patient tools that were really put in here just for the patients. You have full journaling capabilities. You can create a category, or you can use one that's existing. This is a new patient, so I don't have any categories set up. I will put mood issues, track mood issues here. And then I can title it, even if I wanted to do the date, and then I can journal. And all of this is totally up to the person who's entering it. You can have whatever categories you want, whatever that makes the most sense for your organization of your information can be captured here. There is in-platform messaging. So if the advocacy group wants to reach out to you, they can send messages, they'll show up here. We won't deliver this to your email box, but we will deliver a message that says you have a message on platform, and you'll just need to log in and you'll be able to view the message. So for privacy reasons, we keep those messages in platform, but you can respond back and communicate with whoever sent the messaging from there. Documents allows you to store whatever documents make sense for you. Some people just want a centralized place to capture everything. If you forgot to upload your genetic report or didn't have it at the time you first logged in, you can do it now. You'll just click upload to find the document. If it is a genetic test, we want you to go ahead and select genetic tests so that we know to have that curated. You can also, they're collecting, I think, guardianship documents for the biosample project. So you can also upload guardianship documents here. But if it's something else you don't want to track, you don't even have to pick a tag. You can just upload it to keep all of that information in one place. I'm going to escape out of there. Almost to the bottom of the list here, but the Sharing Center is really kind of a neat tool. This allows you to create links and actually expire them. If you want it to expire in a month or never, you can opt what information you want to share. I don't have a lot of information added here yet. What did I add? Conditions, I think, out here. No symptoms. But once you start to have information in here, you can opt what you want to share. So it may be like sharing a link that's always the current medication list for your child that you want to provide to the school, or providing a babysitter information. And anything you opt to share, they click the link, enter the PIN code they were issued, and then they'll be able to see the most up-to-date information. I'm just going to flip this over to print because it's easier to demo. And I guess I don't have any documents out here. So what it will do when they click on the link and enter their PIN code, they will be able to see the most up-to-date information that you've entered in the platform without a login, just that link and that PIN code. So super easy to print or view there. There is also a resource center. So this is an area where your organization can store information that they want to share out with you that you could download. So maybe information about just being diagnosed or something like that. So there may be information that comes here in the near future. And then lastly is our refer a friend option. So if you've met someone else with the same disorder that would like to track their information in the platform, you can simply go in here, enter their email address and name. You can choose the language you want the message to go in, and it will email them a link basically to that account request page. So this is a really quick summary of the patient side of the platform. One last thing I want to point out to you is that the platform is multilingual. Combined Brain has a number of languages out here. So if you are a native Spanish speaker, you can select Spanish. The entire platform, your consents and your surveys will be presented in Spanish. So you can capture it in whatever language you're most comfortable with, and then that data is converted before it's provided over to the organization to share with researchers. So Monica, that's a really quick tour of Matrix. Is there anything else you would like to see in more detail or that I could show?
Well, firstly, I just wanted to say I love that you said if we could build a tool for you, what would it entail? And that is, just so wonderful. Thank you for sharing with us that the survey is tailored specifically to the patient and touching on the tracking capabilities and that they get graphed, which is visually appealing and easy to read. We're planning to do an observational study, so we plan on using this tool across our community. And just ultimately, we're so grateful that this platform exists and that you've created it for rare diseases like us, so that we can share our data with researchers in one place that is validated. And of course, the ultimate goal is to create treatments. But I have a few questions for you. One of them is the green light specific to the US or is it global?
Great question. Yes, right now the EHR integration is strictly for the US.
Okay, are there plans for expansion?
We have looked into it a little bit. The difficulty is the standardization of being able to link to that data in other countries. So as we have groups that may have centers of excellence and we can get that connection established, we can do that. But right now we just cover about 90% of the EHRs within the US. And I will say, if you go to search for yours and you're within the US and it's not there, it asks you for your credentials and it goes out and it tries to find it and then get that set up within Greenlight. So right now it's US, but hopefully be able to expand globally at some point in time.
That's great. And then we have another question asking, what does validated survey mean?
So a validated survey those are standardized measures that have been developed typically by clinicians and researchers and proven to be an accurate representation of the data that they're collecting. And we build a lot of standardized surveys within Matrix. It allows people to capture, data the same across multiple people and organizations. But we also allow for a collection of disease-specific, not necessarily validated measures. So it could even be something as simple as a survey asking about your next conference and the location. That would not be a validated measure. Or sometimes they just want to collect information on medications. But we really do try to steer people towards validated measures.
Great. And I just wanted to turn it over to Agustina because she's our patient care representative and she's here with us today. I'm sure
Thank
she
you,
wants to
Monica.
go over our concierge service. So take it away, Agustina.
Thank you so much. I think I first would like to join Monica in thanking you, Andrea. One of the feelings that you have when you have a diagnosis of a rare disease is the feeling of loneliness. And I think this type of tools, what they really do is they bring us together and they help us navigate as a community that path towards seeking those answers that we much need on our everyday life. So um, I just want to know that we are here, that we are here to help you through the process of onboarding these platforms. I know Andrea has made it very easy, but at the same time, I know that there is a lot in our backs. Like daily life is sometimes very hard and we have a lot on our plate, but we are here to help. I've been through that path. Monica has also done the registration and it's very easy. And there is also a lot of very useful tools that help us deal with that loneliness. And I found that it's very helpful, for example, to keep track of the drugs. We are now running a validated survey on RedCap by the Danish Epilepsy Center. And it was like, I almost pull off all of my hairs while trying to fill that out because my daughter has been with so many anti-epileptics through time. And I thought I knew, but then when you ask me what was the dose 5 years ago, I have to go back and pull the medical records and look it up. And I find that this tab that you have on medicines is super helpful to keep track of all the dose changes. And whenever you need that information, you will have it there and not, combined with a series of other tests, questions, hospitalizations. The decision process making of a doctor in a medical record is very complex, and sometimes we need to extract that data efficiently. So I think this is very helpful. And I also would like to encourage our community to take surveys like the Vineline survey for development, which is a survey that sometimes we have to pay to take. Like if you go to your provider, it's expensive because we have a lot again in our plate. But it's really nice to be able to take that and repeat it over time. So we are able to keep track because as our kids are growing, there is an expected growth line and there is what we are having, and we need to be always able to don't lose track of what's the expected, what's our kids' progress. So I think those surveys are really, really helpful to keep us track with our objectives and have a very close look to the achievements of our kids, and also to identify areas where there hasn't been any and we need to work especially. So we are here to help. You can reach me out by email, by direct message, by WhatsApp. We are very casual and you can reach to us however you find it comfortable and at the time that you like, and I will, as soon as I can, I will respond and help you on board.
I just wanted to say thank you for also mentioning that the Vineland and these surveys are a way for our community to keep quantitative measures. And I think that's really important. I mean, anecdotal measures are important, but this is absolutely the best way to do it. So thank you, Andrea. We're so grateful for people like you and across healthcare who are really creating tools that help rare diseases like us move things along easily. Thank you for being with us today.
My pleasure. Thank you.
Bye.
Bye-bye.